The Mini-Cog is a 3-minute screening tool to help increase the detection of cognitive impairment in older adults. With training, lay healthcare workers, including medical assistants, can reliably administer the entire Mini-Cog and score the 3-item recall. However, the clock portion of the test can only be scored by a physician or registered nurse. The testing results are to be interpreted and recorded in the medical record by a healthcare provider, such as an MD, advanced practice nurse, or physician assistant, who discusses it with a patient and their family. When administering the Mini-Cog, ensure that the patient is in a quiet area, free of interruptions and distractions. It is best to not have friends or family present during the assessment, if possible. Be sure you use the latest version of the Mini-Cog and that you stick to the provided script. The following video will show how to correctly administer the Mini-Cog. We will discuss scoring the Mini-Cog after the video.
Hi Sam, nice to see you.
Hey, good to see you.
It's been a while. I think your last visit in the clinic was about 6 months ago or so.
You're right.
Yeah.
You're right.
Well, I hear from the nurse that you're here to talk a little bit about some trouble you've been having with your left eye. So I'm glad you came in so we can take a look at that. Before we get started with that, we're doing some new things in the clinic. More and more we're looking to prevention. And so when the nurse was in, she was taking your vital signs, looking at the health of your heart and different things. And today we're also going to look at the health of your brain, okay? We call this our checkup from the neck up, okay? It just takes a couple of minutes but requires a little bit of concentration. Sound okay?
Fine with me.
Okay. The first thing I'm going to do is ask you to listen carefully because I'm going to give you 3 words that I want you to repeat back to me.
Okay.
And try to remember them, okay? The words are leader, season, and table. Can you say those back to me?
Leader, Caesar, and table.
The second word is season, like the changes of the season.
Season, and table.
Right, you got it.
Leader, season, and table.
You got it. Now, Sam, what I want you to do in this circle is make a clock for me. First by putting in all the numbers where they go.
All right.
Okay?
Well, the way I would go it, I'd put 12 first, 6, 3, and 9. And then try to figure it out from there. I put the center circle, and I need to put 1, 2, 4, 5, 7, 8, 10, and 11.
Okay. Now Sam,
I'm at your disposal.
Yep. Now I want you to set the time. So it says 10 past 11.
All right, 10 past 11. Well, first of all, I have to go to 10 past 11. So I'll go to 10 with that small arm.
Mm-hmm.
And I'll go to 11 with the long arm.
Okay. Okay.
What?
Nope, that's good. You're done with that now.
Okay.
Now, I'm wondering if you can tell me what those 3 words were that I asked you to remember earlier.
Wow, that's a good question. You really pulled that one on me. All right. I can't remember all 3 of them.
Okay, can you remember any of them?
No, I can't.
Okay, that's okay. Sam, have you been noticing any changes in your memory recently?
Yes, I have.
Yeah?
Yeah.
Okay. Well, I'm glad that we're talking about it
Well,
then.
one of them was season.
Season.
Yep.
You got it.
Because I mistook it with Caesar.
That's right. Yeah, exactly.
Yeah.
Well, I'm glad that we're having this conversation. Maybe what we can do is we'll take a look at your eye, which is why you came in. But before you leave, I'd like to schedule another appointment for you to come back so we can talk a little bit more about how your memory has been.
Beautiful.
Does that sound okay?
That's fine.
Okay.
Scoring the MiniCog involves two separate parts, the 3-item recall and the clock draw. There are 5 total possible points. The patient gets 1 point for each word they can recall correctly for a total of 3 points. A normal clock must include all the numbers 1 through 12, each only once, in their correct order and direction. If the patient writes only the anchor numbers, remind him or her that all the numbers must be written down. The clock must also have 2 hands, one pointing at 11 and one pointing at 2. The length of the hands is not scored. A total score of 3, 4, or 5 indicates lower likelihood of a neurocognitive disorder. However, it does not rule it out. The MiniCog is not a diagnostic tool and therefore should not be used to diagnose Alzheimer's disease or other cognitive impairments. So, to score Sam's MiniCog, he scored 1 point on the word recall, as he was only able to remember 1 word. For the clock draw, Sam placed all numerals correctly, but the hands were misplaced. Because the clock draw is scored full points, which is 2, or 0 points if there are any errors, Sam's clock draw score was 0. Sam's total score was 1 point out of 5 possible points. This score indicates a need for further investigation of cognition. Keep in mind that the MiniCog is not a diagnostic tool and therefore should not be used to diagnose Alzheimer's disease or other cognitive impairments. A total score of 3, 4, or 5 indicates lower likelihood of dementia, but does not rule out some degree of cognitive impairment.